Okay,
The
first
other
I want to,
is here, but
can you hear me? Can you
would,
hear me?
yes, yes, but would you make sure to identify yourself for the record?
Yes, I'm Tashieanna. I just want to start off by thanking the committee, co-chair, and members for the opportunity to testify in support of SB2 bill. My name is Tashieanna Alexandria O'Connor. I live in Waterbury, Connecticut, where my business is also located. I'm a child care family provider of TikTok around the clock 24-hour daycare. I I don't know what happened. It went off. Okay. I I came to Connecticut in 2008 to give my children a better future. At that time, I was offered a job that paid me $60,000 a year. As a mother of 8 children, 2 whom are currently serving this beautiful country, I got a job offer for $60,000. I realized how difficult it was to pay for childcare on a $60,000 salary, with my husband and I making total of $90,000 a year. I decided to get that education, open my own family childcare setting, and cater to nurses, mother, both morning and afternoon shifts. I currently charge underpriced, and I do not charge parents the care for kids the fee that Care for Kids provided. Care for Kids provide this fee, and Care for Kids give parents the ease to knowing that, you know what, I will help you out, but there are fees that parents are allowed to pay. I realize how expensive it is, so I want to be able to help parents, single mom and single dad who works. As I just want to summarize everything: single moms and single dad who works. And I'm going to ask you panelists that if you remember about your grandmother, parents, neighbors who make an effect and form and shape you into who you are today, who become who you become today. Those are the ones you're saying yes to with these bills. When you say yes to bill SB2, you're saying yes to your grandparents. You say children are the future. Our children are the future. Your grandchildren and children are the future. By saying yes to bill and provide more money for childcare, early childcare, mental health for our children, it makes them and shape them to who you are today. And that's what I have to say. I don't want to go into the whole thing. I want to make it small so Christine could have her time. And I just want to leave this with you, that remember who have that effect on you, who shaped you into where you are today. Who was your 3rd grade teacher, your preschool, your neighbors? Who were they? And that's who you're saying that. We shouldn't have to be here to beg for money to help our children. That should not be an issue. But you know what? Unfortunately, it is. Too long we stand back. And now we're here to stand for our children,
Thank you.
our
Your
future.
time is up. Can you please summarize?
Thank you. Unfortunately, that took up all the time, but I do see a hand from Senator Anwar, our chair of both committees. So I'm going to call on Senator Anwar, and he may have a question for you, Christie, as well. Go ahead, Senator.
Thank you so much. Thank you for your testimony. And I think what you described is the story of not one, but hundreds of people in our state where childcare workers are leaving their jobs and childcare centers are just unable to sustain their capacity, which is actually the first part of the domino that is going to result in the workforce not being able to work. And you made it in your personal narrative helps us reaffirm our commitment as legislators to try to do the best to take care of our children and then create a safety net, a home away from home for the moments when the parents are not at home. So I truly appreciate your testimony and look forward to making sure that we collectively can do better to make sure that we protect your industry. And in future, we will have to readdress it completely, but right now we need to protect it. So thank you for your testimony.
Thank you, Senator Anwar. And I do want to ask Christie if this is the experience of most of the people that you're working with.
Yes, I represent All Our Kin. I'm the Vice President for Policy at All Our Kin. We work with about 50% of Connecticut's family child care providers. That's about 900. They take care of about 3,800 children across the state. This is absolutely the experience that they're having. Tashieanna shared one story that is repeated over and over and over again. I want to go back to something that Commissioner Buys said 6 hours ago. She said, we have to fix the whole system and we have to start with the workforce. The request that you all have heard today for $700 million for the next year is to fix that first domino. It's to stabilize the workforce, $500 million to stabilize the workforce, and $200 million to make it possible for additional families to be able to access childcare, like the families that Tashieanna spoke about. So yes, these are not isolated stories. What's extraordinary about the stories you're hearing is that the providers have taken a day off of work so that they could be here with us today. And we thank you.
Well, we thank you for your work, and we especially thank Tashieanna and the other providers that you mentioned that are here today. And we recognize how important it is to hear from them. So thank you. I don't see any hands at this